Bismillahirrahmanirrahim. I'm Mohammad Saidul Islam Sharkar, again in front of you with plasma therapy again, because some people are asking to know about convalescent plasma therapy. For example, they are asking repeatedly, convalescent plasma therapy, is it used first time in treatment? They just want to know, is it used in this COVID-19 case? So it should be clear, is it used in treatment throughout the world first time? That means, is it used first time in treatment? So we will try to make it clear. Some other questions they are asking repeatedly, for example, who can donate plasma, who will be eligible to donate plasma, or how you will be eligible to donate plasma. Some very important questions from general people, and they want to know how to collect plasma, and why do collect plasma from 28 days after recovery. What happens when you donate plasma, and what should you do after donating plasma? So these are the very common questions from the people. So we will try to find out the answers of these questions today through this conversation, inshallah. First of all, I would like to say donating plasma is a pleasurable job. I think donating plasma is a pleasurable and satisfiable experience, and I think this donating plasma is delightful and joyful perception. It's a delightful and joyful feeling, and I think it's a delightful and joyful taste for you people, because this plasma, this convalescent plasma, will save a lot of valuable lives who are excessively suffering, who are exceptionally suffering, who are extensively suffering, who are seriously, who are critically suffering with novel coronavirus infection. And donating plasma, I think, from my conception, donating plasma is an aristocratic job. Donating plasma is a noble and eminent service, I think, and it's a generous, it's a liberal, and I think it's a bountiful assignment for we people, for you people, to donate plasma and to enlarge your hand to save the valuable lives, and you people can show the ray of hope, the ray of recovery, those who are suffering with COVID-19, those who are suffering with the infection of novel coronavirus. So you people can donate plasma as a good job, and I think you can or we can do this to come forward to save the lives, to save the valuable lives, because those who are suffering critically, those who are suffering enormously, those who are suffering immensely in ventilation or in ICU, looking to you people, looking towards us for this convalescent plasma. So I think it's a noble job, it's a bountiful job. So we can extend our helping hand by donating convalescent plasma to those people. So now I want to come to the point. I'm regarding the portion that is convalescent plasma therapy. Is it used first time in treatment? So it should be very clear, and no, we should not have any confusion regarding this convalescent plasma therapy, because it's not a new one, it's not a new treatment. Convalescent plasma therapy, it is not the first time therapy being considered as a treatment for viral infection. That is, For viral infection, convalescent plasma therapy is an old treatment. If I give you some example, it will be very clear to you that is not a new treatment for viral infection. For example, during a such outbreak in 2002, this convalescent plasma therapy was used. In 2009, 2009, when there was an outbreak of H1N1 infection, at that time, convalescent plasma therapy also used. The Ebola virus infection, Ebola virus disease in 2014, and at that time WHO also recommend convalescent plasma therapy for Ebola treatment. Even March outbreak, that is Middle East respiratory syndrome in 2015, this convalescent plasma therapy also practiced throughout the world. And it's very it's the events of very recent years, but you will be astonished to know even in 1918, when there was an outbreak of H1N1 influenza virus, that was also known as the Spanish flu in 1918, about 100 years ago. At that time, convalescent plasma therapy was also used. So it's not a new one in treatment. It is not a stranger one for the treatment of viral infection. So convalescent plasma therapy, I think and I just say it's an old treatment for the viral infection. So don't be confused in case of using this plasma therapy. So and especially for those pandemic SARS in 2002, H1N1 in 2009, Ebola in 2014, and MERS in 2015, and H1N1 influenza virus in 1918. During those pandemic, a protocol for using this convalescent plasma therapy was established. At that time, during those pandemic, it was established. A protocol was established for using this convalescent plasma. And during H1N1 influenza virus in 1918, this plasma was used at that time experimentally. So it's not a new one. Plasma therapy is an old one. So don't be confused to treat by this convalescent plasma therapy for the critical and for the immensely infected patient, enormously infected patient. So during SARS outbreak in 2002, various studies came to a conclusion that convalescent plasma therapy resulted in earlier recoveries compared to regular drugs. That means during SARS outbreak in 2002, there were a lot of studies at the time, and various studies reached to a conclusion that this convalescent plasma therapy evolved, this convalescent plasma therapy ensured and accomplished in earlier recoveries compared to regular drugs, compared to formal drugs, compared to as usual drugs, compared to ordinary drugs. So this convalescent plasma therapy has a lot of trial in 2002 during such outbreak. So this is actually not a first treatment in the world, and these virus fighting antibodies are extensively used in 2002, in 2014, 2015, even experimentally used in 1918 during Spanish flu during H1N1 influenza virus throughout the world. So this is not a new one. This is an experimental therapy for the treatment of viral infection. Uh, Now another question: who can donate convalescent plasma, and how will you be eligible to donate convalescent plasma? So, convalescent plasma can only be donated. I just want to say who can donate convalescent plasma. Convalescent plasma can only be donated by someone who has had the coronavirus. That means who has had coronavirus infection. It is important that donors have fully recovered from COVID-19, and that their body will have enough time, that I have mentioned in my previous video, should have their body have had enough time to have a good antibody response. And their body have a positive result in COVID-19, in case of COVID-19, and their blood, those who will give blood, their blood will be screened, that to make sure for make sure that their blood is safe and healthy. That means their blood will be screened. After collecting blood, their blood will be screened to make sure that their plasma is safe and healthy. During this plasma donation process, your blood is drawn through a needle placed in a vein on your arm. A special machine that is known as pheresis machine will separate your plasma from your blood. And this process is called plasmapheresis through a pheresis machine. And the remaining red blood cell, white blood cell, platelets, and other important components will be returned to your body along with a little saline solution. So plasma collection is an easy process. One important thing we should know: people with blood type AB, have a good demand. People with blood type AB are in the greatest demand for their convalescent plasma, and these make up just 2 in 50 people. So their plasma is universal. Blood type AB plasma is very demanding and universal. That means their plasma can be used by anyone. But this AB type blood is just make up 2 in 50 people, very rare, I think. So currently plasma are collecting no sooner than 28 days after recovery. That is, you can donate plasma 20 days after recovery, 20 days after discharge from the hospital, and you can donate plasma. That means you can donate plasma every 28 days, after, and up to 13 times a year. That means you can donate plasma up to 13 times a year. So very easy, and I will come to make it clear why you can donate this plasma after 14 days or after 28 days, each after 14 or 28 days. So how could you donate plasma, or could you donate plasma? How will you be eligible to donate plasma? If you have had and recovered from coronavirus, you will also need to meet the following eligibility criteria. You will need to meet some eligibility criteria. For example, uh, that means if you have had and recovered from coronavirus, you will also need to meet the following criteria. That means you will have to be aged between 17 to 66 years, and your weight should be more than 50 kg, uh, and you have not any existing or previous heart condition. That means you should not have ischemic heart disease, you should not have any coronary artery disease or myocardial infarction. If you have those diseases, you will be uneligible to donate plasma. So these are the criteria, and you must not be pregnant. You will not be a lactating mother. You will not have any history of miscarriage, and better to and you have not any history of termination uh, within 6 months. You will be fit, and you will be well on the day of blood donation, or on the day of plasma donation. These are the criteria. And one more thing, you have to complete a health check questionnaire to make sure that you are able to donate plasma. That is, there are some criteria that I'd say these criteria should be fulfilled by you and people before to be eligible to donate convalescent plasma for others. Now, I would like to discuss on why do collect plasma from 28 days after recovery. People will be, that means plasma will be collected from 28 days after recovery, because donors need this time to have recovered fully to build up enough antibodies. One will be able to donate plasma 28 days after being discharged from the hospital, or 35 days after diagnosis, if you were not treated in hospital, and blood will be collecting no sooner than 28 days after recovery. That means your plasma will be collected, better to collect 28 days of 28 days since you discharged from the hospital, or 35 days since your symptoms started, symptoms started. So these are these are the reasons why do people collect plasma from 28 days after recovery. Another question is, what happens when you donate plasma? It's a very common question. Plasma donation is a safe and comfortable experience. Most of the donors spend these 45 minutes to 1 hour time very happily reading or browsing their phones. As part of this program, as part of this plasma donation program, you are likely to donate only plasma rather than whole blood, rather than give whole blood. This means you can give plasma every 2 to 4 weeks interval, instead of waiting 12 to 16 weeks between the whole blood donations. That means plasma donation process, you can donate every after 2 to 4 weeks interval. But in case of blood donation, you will have to wait 12 to 16 weeks So plasma donation is a very easy process. Plasma donation, you can repeatedly give your plasma, and up to 13 times a year. Before your appointment, you can prepare by taking as normal. You can prepare yourself by eating as normal. Better to avoid fatty foods, and plenty of drinks to stay hydrated before going to donate your plasma. These are the process. Uh, uh, Another question: what should you do after donating plasma? It's very important. What should we do after donating plasma? Normally, that I have said, you can give your plasma every after 2 to 4 weeks, because your body uh, usually replaces the plasma you have donated in 24 to 48 hours. A very important thing, your body usually replaces the plasma you have donated in 24 to 48 hours, and you can get on with your normal day after donating plasma. That is, you can start up, you can get on with your normal day just after donating your plasma. So a very easy process, and your body will be able to replace those replace those plasma within 24 to 48 hours. uh, 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 what should we do to help you stay well? To help you stay well, you should eat and drinks just after donating plasma. You should avoid heavy exercise on the day. You should avoid hot water bathing. You should avoid using your donation arm to carry anything very heavy for the rest of the day. And you can keep pressure dressing on your arm for about 30 minutes, and the plaster for about 6 hours. So I think you have understand this. What should you do after donating plasma? That means you should avoid heavy exercise. You should avoid hot water bathing. You should eat and drinks as much you can do. You should avoid using a donation arm to carry anything very heavy for the rest of the day. You should keep pressure dressing on your arm for about 30 minutes, and you should keep your plaster on your hand for about 6 hours. So these are the conversation that we wanted to know. My appeal towards the people that life is for lives. We are for ours. We are for you people, and you are for our people. These are the last, but not the least. So we are for ours, we are for others, and others are for we people. So those who are recovered from COVID-19 recently and have passed already 2 weeks to 4 weeks, so you can easily donate your plasma. You can easily donate your convalescent plasma. One more thing that should be clear, that is, we should take convalescent plasma, and we should make it clear. Convalescent plasma and fresh frozen plasma or fresh plasma are not the same. Fresh plasma or fresh frozen plasma is a plasma collected from all people, but convalescent plasma is required. Convalescent plasma is collected from the COVID-19 recovered patients, and these plasma from COVID-19 recovered patients are required to treat the another COVID-19 patients. It's very important thing. So those who are recovered from COVID-19, please, you can show your empathy, you can show your sympathy, you can show your compassion, you can show your commiseration, I think. You can show your graciousness, you can show your kindness, I think. You can enlarge your helping hands to save the other lives, because some lives are in ICU and looking towards you people, those who are recovered from COVID-19. So please, you can come forward to help the to help those diseased, to help those distressed, to help those depressed, and to help those obsessed patients, those who are fighting against COVID-19, those who are fighting against this novel coronavirus infection in ICU. So you can enlarge your hand. You can show, and I think we should show our solidarity. We should show our agglomeration, and we should show our mutual support to others. So number today, last I would like to say that our government is doing a lot. Our government is trying to make some zones, red zones, yellow zones, and green zones. So we should follow the guidelines of our government, given time to time, for the betterment of our people. And people from red zone should not go to the yellow and green zone, and they should be stay in red zone. So we should follow this. We should follow the guidelines. We should follow the actual instruction and real instruction that will save we people, that will save our nation, inshallah. So no more today, more when we meet with other topic, inshallah.